This video will cover important information regarding proper post-surgical care for dental implants. It is important that you watch this video in its entirety to maximize your healing and improve the long-term outcome of your dental implants. Do not disturb the wound. There may be a metal stump slightly protruding through the gum tissue. This is the temporary healing abutment and keeps the gums open for the future crown. Upon leaving the office, please go directly home. Do not stop to eat or drink. Go directly home, especially if you are sedated. It is also advisable that if you were sedated, have someone stay with you for the next 4 to 6 hours. Bite down firmly but gently on the gauze pads that have been placed over the surgical areas, making sure they remain in place. This will help in the formation of the blood clot and begin the healing process. Do not change them for the first hour unless the bleeding is not controlled. If active bleeding persists after 1 hour, place a new folded gauze to obtain pressure over the surgical site for another 30 to 60 minutes. This should be repeated as necessary. After the blood clot forms, it is important not to disturb or dislodge the clot as it aids healing. Do not rinse vigorously, suck on straws, smoke, drink alcohol, carbonated drinks, or brush teeth next to the extraction site for 24 hours. These activities will dislodge or dissolve the clot and retard the healing process. Limit vigorous exercise for the next 24 hours as this will increase blood pressure and may cause more bleeding from the extraction site. Unfortunately, most oral surgery is accompanied by some degree of discomfort. You will usually have a prescription for pain medicine, and if you take the first dose before the local anesthesia wears off, you will be able to manage the discomfort better. Use the pain medication as directed, but please call the office if the medication doesn't seem to be working. An ice pack or an unopened bag of frozen peas or corn applied to the area will help with pain and keep swelling to a minimum. If antibiotics are prescribed, continue to take them for the indicated length of time, even if signs and symptoms of infection are gone. Drink lots of fluid and eat nutritious, soft food on the day of the extraction. You can eat normally as soon as you are comfortable. It is important to resume your normal dental routine after 24 hours. This should include brushing and flossing your teeth at least once a day. This will speed healing and help keep your mouth fresh and clean. After a few days, you will feel fine and can resume your normal activities. If you have heavy bleeding, severe pain, or continued swelling for 2 to 3 days, or a reaction to the medication, call the office immediately. Bleeding should never be severe. If it is, it usually means that the packs are being clenched between your teeth rather than exerting pressure on the surgical areas. Try repositioning fresh packs directly over the surgical area. If bleeding persists or becomes heavy, you may substitute a tea bag dampened with warm water for 20 to 30 minutes. The tannic acid in the tea acts to activate the clotting factors in your blood. If bleeding remains uncontrolled, please call our office. Often there is swelling associated with oral surgery. You can minimize this by using a cold pack, ice bag, or bag of frozen peas or corn applied to the area of your face for 20 minutes on and 20 minutes off during the first 48 hours. Also, keeping your head elevated will help. Sleep on 2 pillows or consider putting a pillow under your mattress to elevate your head for swelling control. After the first 2 days, switch from cold packs to moist heat to bring more circulation to the area and begin to help the swelling resolve. Swelling peaks on the 2nd or 3rd days and usually resolves over the next 4 to 7 days. Eat any nourishing food that can be taken with comfort. If you were sedated, start with clear liquids such as apple juice, tea, and broth in case you are a little nauseated. If you tolerate this, you can move up to soft foods like soups, eggs, mashed potatoes, pasta, soft meat, and anything pureed. Temperature of the food doesn't matter, but avoid extremely hot foods. Avoid foods like nuts, seeds, popcorn, hard breads, etc. that may get lodged in the socket area. Over the next several days, you can progress to solid foods at your own pace. It is important not to skip meals. If you take nourishment regularly, you will feel better, gain strength, have less discomfort, and heal faster. Do not smoke because smoking reduces the blood flow, contaminates the healing wound, and frequently leads to infections. It is important to resume your normal dental routine as soon as possible, even the day of surgery. This should include brushing, flossing, and rinsing at least twice a day. You may or may not have sutures, stitches, at your surgical site. Be very careful when brushing to avoid these. In most cases, Dr. Cohen uses dissolvable sutures which will come out 3 to 5 days after surgery. Brush your teeth gently, avoiding the surgical area, for the first 2 to 3 days or until adequate healing will allow you to carefully clean the area. Dissolve 1/2 teaspoon of salt into 8 ounces, 1 cup of warm water. You can rinse gently when brushing your teeth or more often if you'd like. You can't keep your mouth too clean, but avoid vigorous rinsing for the first 2 to 3 days as to not disturb the blood clot. Rinsing flushes away food particles which may be lodged in the surgical area and helps to keep things clean. It is our desire that your recovery be as smooth and pleasant as possible. Following these instructions will assist you and obtain the best outcome for your surgery. If you have any questions about your progress, please call the office at 713-790-6477.